Right, MS. So she said, oh yeah, without a doubt. Omaha, the Birds, as well as the Bluffs. We have Director of Health and Human Service, Dannette Smith. Okay, so how you doing today?
I'm doing real well. Glad to be here on your show.
Okay.
It's a hot day, but it's a wonderful day.
To be alive, I got all my social media up. So make sure you guys go to our social media if you're in the house or you want to share it. I'm just gonna let her talk because when you get the director of the state of Nebraska, oh yeah, you just sit back and listen. You know what I mean? So I want to first of all kind of get to know her. I want to let you guys get to know her. Let me turn the music all the way off. Just want to get to know her. So, Director Smith, who are you?
Well, how far back do you want me to go?
Well, you can give us a synopsis.
I'll give you a synopsis.
Okay, I mean, you go back to from the first day you remember our life.
Okay, all right. So I came from a little bitty city called East Chicago, Indiana, which sits right outside of Gary, Indiana, and right in between Gary and Chicago, Illinois.
Interesting.
So that's my hometown. I ultimately moved over to Chicago, where most of my professional career was in, and lived on the south side of Chicago, lived on the near west side of Chicago, and then moved out to the suburbs.
Okay.
And then I'll do a fast track. Then moved and lived in Charlotte, North Carolina, and from Charlotte to Atlanta, Georgia, to Seattle, Washington, then to Virginia Beach, Virginia, and now Nebraska, the state of Nebraska.
Now, of course, your experience have been with people all those journeys.
All of my journey, I've been working in human services, from child welfare to benefit programs to behavioral health to juvenile justice. And now what I like the most about this job is I do all of that, and I do public health too.
Public health also?
Yeah, so I have 5 divisions here in Nebraska. Our budget is $3.6 billion.
Okay.
There are approximately 4,800 people that report up under me. So the Department of Health and Human Services is the largest state department for the state of Nebraska.
Okay.
I got to Nebraska in February of 2019, and it's been a whirlwind, but I have to tell you, I really, really enjoy it.
Great. Now, being a sister, being in obviously you come from where I come from. I got relatives in Gary. I got relatives in South Side of Chicago also. So you know the struggles of the environment. Does that experience, does those early obstacles help you in your decision making now?
Absolutely. I was lucky to work for a man by the name of Sakoni Karanja, who was well known at the time within the city of Chicago, but did a lot of work on 47th and Cottage Grove. 47th and Martin Luther King Drive. That's what I should call it. It's now called Granville. It was called Garfield Park when I was working for him. And one of the things that I think I learned from him was the importance of community engagement. You really have to, in order to do this work right, you have to be amongst the people that you're trying to serve. And you have to be respectful to the people that you're trying to serve. And they need to be a part of having a say in the work that you're trying to accomplish.
I'm 55. I'm 55. No jive. I'm 55. Now, some people, I like that methodology, because some people, even though they work in the community, have developed a callous with the people that they work with.
Right.
And still, we have a lot of people that have calluses, which create a perpetual cycle that we're not rising. Who taught this?
So I say my parents. I've had some really good people I've worked for who have been honest with me about, if you ever, being an African American woman, I don't get a pass. I've got to do it right the first time
The
out.
first time.
But I have to do it with good integrity and good ethics. If that makes any sense?
Without a doubt. Without a doubt.
I have to, and that's the only way.
No ifs, ands, or buts.
Right. That's how I operate. But what I do try to do is I don't forget where I come from. That's why I can tell you I came from a little city called East Chicago, Indiana, because here's what I learned from my hometown. It's a steel town. Everybody worked. Right. Everybody worked hard. I saw that from being a little girl until I left and went to college and then went off on my own. I have worked for and been raised by people who have good work ethics, but no, the most important thing was that I was taught to respect my people. Right. So when you are taught that, and then your career, you are surrounded by people who support that vision and help you grow that vision. Right. It makes it easier for you to be able to do the right work. Okay. And so that's kind of how it's all happened for me. I enjoy the work that I do. I don't want to say that it isn't tough. It isn't without criticism. Right. But for the most part, I think when you're honest, you work with integrity, you're authentic about who you are, good, bad, or indifferent. I think that helps you do the work, and it makes you be a person. I'm a person. I love this work. Right. I do it because I love it.
Now, you are the matriarch of the Health and Human Service of Nebraska. So, since you have this role, how can we help you make your job easier? Because even though you're at the top, doesn't mean that it's easy. Right. So how can the people at the bottom, those unsung heroes, help you?
So whenever possible, ask me and my department out to your community, to your function. One of the things that I'm really trying to change here with the Department of Health and Human Services is that I want us to be more engaging. I want us to get out and understand the community that we serve. Yes, we receive federal and state dollars, but if we don't have a vision ourselves for how that money needs to be used, then it won't be used appropriately. Does that make any sense?
Without a doubt.
So, you know, whenever invite me and or my department leaders out and our staff out, encourage us to engage with you. Don't say that's the state they won't come out. Okay. Don't say that. Right. Make us come out because our job is to serve.
Without a doubt. Let me ask you another question. Are you the first African-American woman to serve in this position?
No, I'm not. Before I got here, there was a young lady by the name of Courtney Phillips who was here.
Okay. Well, I never heard of her. She did no outreach. So obviously you're taking a different approach.
Very different. Very different. And I guess, you know, for me, it's really not a different approach. It's who I am. I don't know how to work in state government without community engagement. So I'm very comfortable. Okay. I am very comfortable, as you can see, being here.
So you like sitting behind different desks. You know, so you don't mind getting around your desk.
I do not.
Okay. All right. Okay.
I do not.
Okay. Just so you like doing the work of Jesus then. I hear you. Yeah. I'm gonna take a little drink to that. I'm drinking H2O, y'all.
That's right. No,
without a doubt.
Well, you know, I think that if you are in the work of servitude, you have to know the people you serve, and vice versa. They got to know you.
I see.
They just got to know you.
I've been. That's why we celebrate Winning Women Wednesday, because we need women minds in leadership, because we need some. Because my mama, boy, she a bad woman, 5'5", no job. And so the way you think is necessary at this time.
Yes. There are a lot of people who are hurting. There are a lot of people who look like us who are angry. And so we have to figure out how we work that through. And I think it calls for a lot of wisdom, a lot of patience. And as I said to you earlier, we got to listen more and talk less. Just be in the spirit of listening. Okay. And understanding that maybe I don't have all the answers. And so I say that a lot to my staff. They'll ask me something. I say, I really don't know. And they're like, what? I said, I don't really know. I'm stuck. And so we'll have to find somebody who has the answer. So I think we're in an environment right now where we are being allowed to really get to know each other, because we can't do anything but that now. Right. And so I think that's a good space to be.
Okay. What is so how are you guys handling the pandemic? how are you guys as far as your staff and how are you guys working? Are you guys working from home? Are you in an office now?
Right.
And how's that going to look for you guys as the end years?
Well, I don't know how this is going to end, but I can tell you right now that we transitioned about 45% of our staff home. We are bringing our staff back into the office. We are asking, not mandating, but we're asking people to wear masks because most of us are downtown.
Right.
Okay. And so we're asking them to wear masks. I can tell you that the pandemic, I am so proud of my staff across the state.
Right.
They have made sure that everybody is served and that we're not having anybody lose benefits or support. But my public health team, there have been nights when they've been up all night to make sure that we have the correct data, that we're advising the governor the correct way, that we're working with the hospitals, local public health departments, HCs, nursing, long-term care facilities, all of the associations and providers, so that we're getting a lot of word out there about the importance of testing.
Right.
That's number one. Got to get tested. Number two, if you test positive, help your local public health department know who you came in contact with so we can do the contact tracing. And the reason why contact tracing is so important is because the more that we know who you've been in contact with, the more we can get them isolated.
Right.
Okay. Get you and those persons isolated, or those persons who have been exposed, we can get them tested immediately.
Right.
Yeah.
Has I heard the SNAP and the EBT program, has that been extended or increased? Yes. And how can people have it? And for those that might want to acquire it.
Absolutely. So the SNAP program is still going on. We encourage you to do an application if you feel as though you need additional services. We are offering what is called PEBT. Some of your listeners may have heard about that. We want them to go to Access Nebraska to apply for the EBT, that's pandemic EBT card.
Okay.
And we have 2 times that we will be dispersing that money. Once toward the end of July and again in August.
Okay.
If they have had a free or reduced lunch, that is one of the areas I think that qualifies you.
Okay.
But my staff are well aware. Explain it. Please go to Access Nebraska. And apply. And I'll also get you some phone numbers that you can put out in the station.
Well, we got to be part of that partnership because
absolutely.
We the baddest, the boldest. We the boss. We've been around for a long time. Been working hard for this,
right?
And so, man, that I got goosebumps over that because I mean that can help out our people so much.
It can,
without a doubt. Just God said we're destroyed because of lack of knowledge. Your approach, man, you are necessary, Director Smith. The outreach. Because trust is people just don't trust people right now.
Right.
And so what you're doing now is I call it a love thy neighbor move. You know what I mean?
You want to call it?
Oh, that's what I call it. That's what I call it. I coin things here. I nickname. I don't got a nickname for you yet.
Okay.
But I love your spirit. But what you're doing is a love thy neighbor move when you actually come out and reach the people. Teach the people, but also the main thing is listen to the people.
That's right.
I want to flip to Medicaid expansion because it's been all this talk that the governor is not going to expand. Medicaid got passed by the people, and when the last time we talked, you said that's all you've been working on. I said what? So it goes to show you that when you allow other people to talk for you, the mess is always going to be foggy. But when you come in and talk for yourself, the message is clear. Could you clear it up for us?
Sure. Medicaid expansion is on its way. We will be taking applications August 1st.
What?
So August 1st, applications will be taken. Then we will begin the program officially October 2020.
Okay.
Our Medicaid expansion will have 2 tiers to it.
Okay.
So those persons that qualify for Medicaid expansion will be at what we call the basic tier.
Okay.
The second tier structure are for those that we would consider to be more vulnerable. And that would be those persons who are pregnant, those persons between the ages of 19 and 21, and those that are considered medically fragile. Okay. What's good about Nebraska's Medicaid expansion is that we don't necessarily have a defined work requirement. Now, there are going to be some requirements that you will have to do to get up to the prime. And when you get to prime, let me tell you what's in the prime level. In the prime level, you get all the basic medical care, primary, ambulatory care, not behavioral health, skill services, all of that you get at the basic level. Right. Ambulatory, I said primary care, emergency, basic services you get. When you get to the prime, what you will get in addition to is dental, vision, and over-the-counter medication. That's what's different. So you don't necessarily get that at the basic level. You get that at the prime. Okay. So the requirements that we had ultimately set out was to really help people get back to work. And one of the ways to get back to work is take care of your physical health. So we want you to get signed up with a case manager from our MCO. Who can better support you. We want you to consider going to school, doing some volunteer work, looking at community college for college credit. Those things that stimulate the workforce. But what's most important is that you're stimulating getting back in the workforce by looking at your own physical and behavioral health wellness. And as a people, one of the things we don't like to do is we don't like to go to the doctor. We wait till something get bad and then we're running into the emergency room. We want to change that behavior. Well,
I need to change that. I'm going through behavioral modification myself, director. Oh yeah, I'm going through it myself. Shouts out to everybody that do the free clinics, the free health fairs without a doubt, because
well, you should do that. That's still taking care of yourself.
Well, I'm glad you talked about this, because I interviewed a couple of families that actually moved to Iowa because Nebraska didn't take the Medicaid expansion early. Right. And so I'm glad you guys working on that. Maybe more people come back into Nebraska so we can.
So August 1st, applications.
August 1st.
And then October 1 is when we start officially.
Well, I'm going to advocate that we be part of the messengery.
Absolutely.
We gotta be part of your tentacle in the community, because our goal here is to make sure that we participate in the raising of our community, and knowledge is key. And so,
well, knowledge is power. So the more you know,
right,
the better off you are,
without a doubt. And the more we can put in action, y'all.
That's correct.
We put in action. Director Smith, what else are you working on that people have the perception that government is not working on?
Well, I think the last time we talked about the community cares money. We got federal dollars.
So
there were about $85 million that my department would be issuing out to the community.
And how?
And the days for applying for that money have now passed. But we'll be doing some awards over the next couple of weeks. But the grants focused on kind of stabilizing some of our non-for-profits, and they were able to get a maximum of $12,000 from us.
Oh yeah, actually that was said to this. It was reopened
and
rescinded to this Friday.
That's exactly correct.
Oh yeah,
you're on it.
Oh yeah, we're about to buy it over here, baby. We're about to buy it over here. Yeah. We're promoting that. Without a doubt.
And we've gotten a huge response.
Great.
For all three grants.
Great.
All three, we have made sure as much as possible that the grants are really serving communities of color. So we've allowed for people to do partnerships and collaborate with one another. So there's three grants. The stabilization is the first one. There we're issuing out about $40 million. The second one is a traditional grant. And that one will be distributing approximately $43 million. And then this one is where we're going to pay for PPE, disinfectants, for child care centers, for churches to open back up.
Right.
You can get between $250 to $500.
Right.
And pay for PPE.
Right. Actually, I think some of that has already started. I've
It
been,
may have,
yeah,
yes.
I've been trying to keep up on that because we're informing the community of the opportunities that exist because of Corona,
Yes,
especially because overall it affects our mental health.
that's correct. That's
And
correct.
since we talk about mental health, what is your approach on mental health? Is there any initiative? Because since people got to stay in, there is. I'm a former probation officer.
Yeah.
I grew up in this community. I love my mom. Always just used to say, "How can you hurt a child?" Man, that shit used to make her sad. How can you hurt a child?
Right.
And so that you cover that also.
I covered
So
that also.
foster care. Um, oh man, even decisions. I don't know if how political you can get. Even taking police officers out of the schools and intermit and replacing them with maybe more mental health interventionists or more therapists. So conflict versus using a penal approach.
Right.
When I grew up in school, when we had fights, ill fights in school. And so usually you either get suspended or you get sent to the the sack,
Right.
to the portable, off, you still be in school.
Right, right.
Yeah, you still be in school
Right.
because no, you still come to school, you still get educated. We're gonna let you bad behavior. So they still had that approach. You're responsible for all those young people. School's coming back. You got an enormous job. I mean, so do you cross section all
I
that?
cross. So what I would say to you is that I work very closely with NDE. That's Nebraska Department of Education.
Okay.
They oversee all of the school systems.
Okay.
But from a public health standpoint, we've been able to advise and support as the school districts need as they look at their plans for reopening.
Okay.
We are very concerned about mental health, what it has meant to kids who have stayed at home, but also what is it going to mean to go back to school, because school is not going to be the way that they remember it. I know that many of the school districts right now have mental health support that they have in the schools. The state stands ready to be able to support wherever we can.
Okay.
In other jurisdictions where I've worked across the country, mental health was always in the schools from at least elementary, at least to middle school, or from middle school all the way to high school.
Right.
And I know in the Omaha public schools, I think that they have some mental health supports already in the schools to be able to help some of their schools that they may have some specific concerns about.
Okay. Anything? What else is going on down in Lincoln?
Let me talk a little bit about child welfare. Foster care, if that's okay.
Yes, ma'am.
We have about 3,500 children in the foster care system.
Okay.
And I've worked from Chicago, where there were close to over 50,000 kids in care. And we only have 35 here in Nebraska. And for me, that's way too much.
Okay.
And so your listenership is going to begin to see us look at how we use more of a prevention lens than just putting kids in foster care. Of course, we have to follow the law. So if the law says that a child has been abused and neglected, and after that investigation necessitates that the child is removed, we're going to have to follow the law. But what we want to do is we want to take a couple of steps back and work with the parents and the child so that they don't come to the attention of our system. So you're going to hear a lot more about, again, community engagement, because we know that communities save and support children and families. I know that. I've done it my whole career. Okay. And that's how if you want your child welfare system to be effective, you've got to engage the community. And then the second thing you have to do is you have to engage your judicial bench. And thirdly, you have to engage your community providers to be able to support that. So we want to bring that 3,500 kids down as much as possible.
Well, I mean, no, if we look at the, like you said, the penal, if you look at the penal system, especially since we're looking at racial inequities, equalities, health disparities, and all that. And so you even in that role also.
Yes.
So what else do you do? I mean, what do you do to relax? It seems like you got a lot of stuff going on.
Well, I'm golfing these days, although today it's hot outside. But I like to golf. I picked up golf when I lived in Virginia Beach, Virginia.
Okay.
I love golfing. I've met a couple of friends here that I golf with, and so I do that.
Okay.
Don't read as much as I used to because my mind is constantly thinking, but I probably watch way too much TV and Lifetime, and I golf. And I enjoy. I've met some really nice friends here in Nebraska, and so it's just been a good 17 months here for me.
Great. So far, so good. Anything else you're working on?
No, nothing that I can think of that I wanted to talk about. I know we want to come back while we're implementing Medicaid expansion and talks more specifically. And I'd like to bring Jeremy Brunson back either on the phone with you to really talk specifically about Medicaid and what we're doing. I gave you a highlight, but we're looking at approximately 90,000 people that may end up being on Medicaid expansion. And so we're preparing for that. We may see a little uptick because of the pandemic. So we're making sure that we're ready.
Is there an age requirement, age limit?
Don't know that offhand.
Okay.
Don't know that offhand.
Okay.
Yeah.
But we'll get you guys that information because, some people are close to retirement, but some people might be young and might be.
No, if they're young, they still can apply.
Okay, you can?
Because remember I said that Medicaid, there will be some people from 19 to 21.
Okay.
Right? So they can apply.
Okay.
Yeah.
All right. How can people get in contact with you since you're willing to come out to speak to different groups? You're willing to have your staff come out to the community?
Absolutely.
How can they make that engagement?
So it's Dannette.Smith@Nebraska.gov. That's my email address.
Is that easy?
Yeah, it's that easy. And people are often shocked. I do answer my phone and I do answer my emails. I do ask the public to allow me close of the next business day to answer my phone messages and also to answer my emails.
Okay. Let me see. I guess we're gonna have you back on the show next week with Medicaid director.
Jeremy.
Yeah. Okay. Good. So you'll come back. With, this is gonna be your second home. We want to let you know that you're always invited. You're always welcome here. We always want to make sure that we have accurate knowledge. We have the health department come in every Friday, so we're making sure that we're getting accurate health information so our people can make accurate decisions.
That's right. And I know that they're pushing get tested. And we had two events. One at Omaha Public Housing Authority
over at Jackson Tower.
That's right. And then the second one was over at Salem.
And that's where I grew up at, right there. That's where the project. Yeah, and I heard that's record numbers. I think they had over 400 some people tested. According to the health department, came in. I think over 700 people over the weekend. So it's a great thing when you do outreach. The community will respond.
Maybe when I come back with Jeremy, we will talk a little bit more about Medicaid expansion. But I also would like to talk about the YRTCs. You're probably hearing that on the media.
Okay, no, go ahead, go speak now. Speak now, mademoiselle.
Well, we announced this week that the girls there. When I first got here in February, I had been visiting out in Geneva at the Youth Rehabilitation Treatment Centers. Was concerned about three things. One, the level of staffing. Two, the facilities. And number three, the programming. It necessitated that I move the girls from where they were located in Geneva to Kearney.
So you're responsible for that also?
I'm responsible for that as well. So I moved the girls from Geneva, moved them into Kearney, and that has been a temporary placement for them. And so we announced this week that we think we found a new home for the girls, and that's going to be in Hastings. At what was the regional center. There in Hastings, there's a brand new building that was built for the young men there for substance abuse. I'm going to move that substance abuse program into Lincoln. And they'll receive their treatment from the Whitehall campus. And I'm going to move the 16 girls to the brand new facility there in Hastings. And that'll be their new home.
Without a doubt. Shouts out to Hastings. They make Kool-Aid out there, the home of Kool-Aid. Without a doubt. My teammate from high school is the head coach at Hastings College out there. Shouts out to my man Bill Gavers. I run stuff over here, Mr. Smith. I'm a little guy. I'm just a little guy from the Hilltop Projects. But that is a great move. That is a great move. I know that even though they are in those conditions, at least they're in the best conditions possible while they rehabilitate.
And so what we want is, for at least my goal while I'm here in Nebraska, is to make sure that the youth under our care are thriving. And the only way that they can thrive is to live and be in good facilities, have good staff, and have good programming. And so that's what we're out to achieve.
Okay. All right. Sure. All right. All right. Anything else? What else you do? Because you do a lot of stuff. I know. I understand why you golf. I probably can't beat you. But
you probably can.
No. I always slice it to the right. I always go to the right. But I could putt all right because I just play putt golf.
Okay.
Yeah, I could do that. I could beat you in that, Miss Smith.
Okay.
I don't know. I'm just talking smack. So no, we appreciate you. You are necessary
being here,
man. You are necessary. You are a breath of fresh air.
Thank you.
I love your approach. I'm glad the governor made a decision to add a breath of fresh air to Nebraskans.
Thank you.
By your approach to listen to the people. Usually when you listen to people, that's usually when you get your problem solved a lot quicker.
You do. You really do.
Mm-hmm. So a lot less stress. How can they get in contact with you again?
Again, it's simple as my email address, Dannette.smith@nebraska.gov, and it's DANNETTE.
Okay.
Smith@nebraska.gov.
All right. I'm getting prompt already. You said you got to go. You got to go. You know how these superstars are, Omaha. You know how these superstars has been on my message. God, no, brother, I ain't mad at you. I need an assistant like that.
She takes care of me. She really does.
Oh yeah.
She takes care of me. She makes me get to where I need to get, and she keeps me prepared. And I'm so blessed to have her on my team. I really am.
Oh yeah, without a doubt. Also, make sure you guys go to the Access Nebraska for benefits. Yes. Access Nebraska for benefits. Also, make sure you check us out next weekend. We're gonna have the director back, as well as hopefully the director of Medicaid will be talking about the expansion. See how make sure that you know what to do to take advantage. Okay. We're going to make sure that no one is ignorant in this process. We'll go through the ABCs. And so there's no excuse why we didn't get it done. All right. We're not going to participate in the ignorance here at the boss. Oh, no. We're going to be bringing in the decision makers, and so we can get it done. Director Smith, I want to thank you for accepting the job. I want to thank you for being proactive to create relationships.
Thank you. I appreciate that. And we'll be back with more information. I know that Jeremy will be able to get more in the weeds with you, but you'll like what he has to say.
Okay.
I gave you the 50,000. He's going to bring it down to about 15,000. Okay.
That's all right. That's all right. You know, sometimes we need to hear from the high. We got high hopes. Hold on a second. Let me make sure that I did not miss anything. Precious, she said, good job, Will. Thank you, Precious. Okay, Phil, good job. Good interview. Let me see, Miss Jackson. I saw her for the first time on the news the other day. I am proud and impressed as a former DHSH employee. She is a very personal person. I appreciate her updating the public about what is now going on at DHHS. Looks like she is making a big difference. That's from Miss Jackson.
Thank you.
Okay, let me see what else the community got going on. All right, we got some big ups. We got a lot of people sharing. So people are watching you.
Thank you.
Well, people are watching you. So again, you are impressing everybody you're doing.
Thank you.
You know, the basketball players don't got nothing on you. They don't got nothing on you. They don't got nothing on you. I told you, when you make a love thy neighbor move, oh man, that is the greatest move of all. I get goosebumps when people make that love thy neighbor move, because those are the ethics that I learned in Hilltop Projects. We had people that fed us, but also when we was mischievous, oh no, they gave us that tough love. They gave us that tough love because we had a responsibility upholding our families' names. And so I'm proud that my mama raised me in the projects. I have the greatest ethics. A lot of y'all new masters with the remote controls, y'all need contracts. But our word were bond. When we said we was going to get it done, we got it done. And so those are the greatest ethics. Shouts out to my mama and my daddy. Those are my heroes. Let's pay attention to our elders during this pandemic. It's going to be hot these next few days. Please be proactive. If you got an extra fan and you know somebody need the fan, go give them the fan. If you got an extra air conditioner somewhere, donate it to a neighbor if you know they got some heat. We got a lot of elderly people that need to be cool. There's more death through heat. Yeah. And so also remember you can call 211. That is the emergency number for anything domestic. You can call it 24/7 and they'll guide you if you need a fan or anything like that. Also, there's going to be assistance when it comes to rent and mortgage. So no one is put out on the streets during this time. Like I said, we are about it. So if you know anything that can help out our neighbor, make sure you give us a call here so we can spread the knowledge, y'all. All right. These are the ethics that I learned in Hilltop Projects. And this is why I talk about it so much, because these are the things that have guided me through life. And my mama is batting 1,000. And so I want you to bat 1,000 too, at least 999. You know what I mean? All right, Doc. Hey, director.
Yes.
Anything else?
That's it. You've covered it. We've covered it.
We covered it?
We've covered it.
All right.
Until next week.
So I cut my hair last night. I know you was coming here looking good to this week. So I was over there getting my hair together. I was trying to get my stuff together too. So Omaha, we got some more guests coming up. We got a big show this weekend. We got car racing, drag racing, sound show. We got the guests. They in the house. They came in from Florida, Texas. They St. Louis. They came from all over to. And if you want to race your own car, they will, do all the tech stuff to make sure your car is safe. But you can go out there and race your own car on a legal track. You don't have to be on the streets, y'all. See, we bring you good information. We about it over here. Omaha, we're about to take a musical break real quick. We're going to bring our next guest in. Director, we appreciate you again. You are necessary. You're necessary. We're going to be bringing the Director Smith back again from the Health and Human Service Department of the state of Nebraska, without a doubt. We'll take a music break real quick. Take a couple pictures. Boss with us.
YBB, young black visionary, YBB, YBB. I see the light and we walk into it, tapped in worldwide, hot power, listen to this mind shower. Meditation deep, then it woke me on my sleep. How we still ain't make that leap to where we supposed to be? Could it be a lack of empathy for one another? We bear fruit and we chopping down a tree. Meaning once we taste success, we forget about the rest. Sip until nothing's left, then board a private jet.